2 years since the Control of Tobacco and Electronic Delivery Systems Bill was closed for public comment. Researchers are calling for it to be passed to tighten controls in this unregulated sector. Now, research on e-cigarettes and smoking cessation has found that 95% of e-cigarette users continue to smoke in public. Let's unpack the story for you. Professor Lekan Ayo Yusuf is director of the Africa Center for Tobacco Industry Monitoring and Policy Research. That's at the Sefako Makgatho University. And Dr. Kgosi Letlape is from the Health Professions Council of South Africa. Both of our guests joining us via our video link this morning. And a very good morning to you once again to both our guests. I think, Professor Ayo Yusuf, let's begin with you and get a sense of where you are at in terms of whether e-cigarettes do indeed need to be urgently regulated.
Thank you very much for the opportunity. Good morning to your listeners. Indeed, from evidence and practice around the world, e-cigarettes are regulated like any other product in order to maximize public health. To the extent that it is not safe, it is indeed less harmful than smoking traditional cigarette, but in any public health measure, it's a balance between risk and benefit. Yeah. And so the question that we asked in terms of our research to support regulation was the kind of benefit that you could get from e-cigarettes. Now, the biggest benefit that you can get from e-cigarettes is if it's directed at smokers. Who are able to quit smoking, because we've got about 8 million smokers in South Africa, and the fastest cause of death would be those who are currently smoking. And we found that, unfortunately, e-cigarette as used in South Africa does not assist smokers to quit, at least in the long term. So therefore, having e-cigarettes unregulated so that it's now also open to young people to be recruited into a habit that they would have otherwise not used under an unregulated environment is not good for public health.
Dr. Letlape, let's get your opinion on indeed whether enough is being done in terms of e-cigarettes. If they are going to be used, it should be directed at smokers themselves, because smoking is more harmful than e-cigarettes. Where do you stand on this debate?
I fully concur with that statement that e-cigarettes or any other alternatives to combustible cigarettes that have been purported or proven to be less harmful should be promoted, and that should be directed to those that smoke. As the study shows, 97.5%, I guess, Prof, of the users are smokers. So it is still getting to the intended target. I think the key issue is the fact that the Prof alludes to the fact that the e-cigarettes and other alternatives are less harmful than tobacco. And I fully agree that they need to be regulated. But what cannot be done, because we see the harms of cigarettes in long-term users, we cannot deny alternatives to those that are using the most harmful way of taking in your nicotine. And I fully agree that we need regulation. We can't have an unregulated industry. There are devices that are being utilized in using these alternatives, including heat-not-burn. There are other alternatives like snus, and we need to encourage those that cannot quit to move and switch to less harmful products. Yeah,
absolutely. Because, Professor Ayo Yusuf, the issue now is that young people in particular who may not be going to cigarettes as a first option, these are non-smokers, they will now opt for e-cigarettes as sort of a port of entry into this industry.
Yeah, so the total public health assessment, as we say, we look at individual harm and population level harm. So at the individual level, while we know that the toxins that would emit from an aerosol of e-cigarettes is lower than that of a traditional cigarette, at the population harm, of course, we do not know whether that eventually translates in 20 years' time to reducing your cancer or for in particular, if you continue to use both e-cigarettes and continue to smoke, we do not know that is going to reduce your risk in any case, like the picture of the profile of e-cigarette smokers we have in South Africa. But never mind that. On the population level, if we do not have enough smokers quitting because of e-cigarette, on the one hand, and on the other hand, you have youth picking up this nicotine habit, which is not harmless. They have addiction. Nicotine itself is not innocent to the body. Then if you add that together, you have a bigger population harm. And this is what the question is about. To what extent, and of course it even gets worse, if those young people then move from e-cigarette use to combustible use because now they're getting nicotine, they might not be getting enough nicotine, and then they move to the more efficient delivery of nicotine, which is cigarette, is the most efficient. Then we have a worse off public health situation in South Africa.
Yeah.
And that's the reason why it should be regulated.
Yeah, Dr. Letlapie, I mean, effectively what it means is that e-cigarettes are in fact not a way of quitting smoking at all.
I have always advocated that the industry should not talk about quitting. They should talk about switching. Because for me, as a harm reduction advocate, where I start is if you smoke, quit. If you can't quit, use less harmful products in terms of what we know. So we're talking about switching, not quitting. And I hope that as we regulate, we would base regulations on what we know rather than on what we do not know. We do not behave like futurists and predict what's going to happen in the future. What I would hope the academics like the prof would do is to do proper research into those subjects. You know, it's like people that are anti-vaccine talking about what we don't know, talking about 5G. We have to base policies on what we know. And as Prof said, what we know is that these products and other products are less harmful than combustible cigarettes. We should be cautious about gateway hypothesis. We should always discourage youth uptake. Whether it's of combustible cigarettes, whether it's of the alternatives, we should be promoting people to stay away from tobacco and tobacco-related products. So really, the issue about if they start, this might be a gateway, this should be subject of research. But also remember that once we start talking about ideas, thoughts, and we're now getting into an area that is not science. We're getting into prophecy. And I am steeped in science. And I would hope that researchers like Prof. Yusuf would research these issues and put empirical data on the table and not ask regulators to propose policies on what ifs.
Yeah.
That becomes a treacherous road to go by. Remember, smokers are human. We have adult smokers that are having serious health effects from getting their nicotine in the most dangerous form in terms of combustible cigarettes. And whatever is happening at the youth, I fully agree. We have serious attempts to educate you not to take up the nicotine habit in whatever form. But what we require is credible information and education of people so that they make informed choices. But we should never, ever forget that the impact on the healthcare system is from people that have been smoking for years. It's from adult smokers, and they have a right to be given access to less harmful products.
Sure. Professor Ayo Yusuf, what's your response to that?
I think I would encourage Dr. Letlapie to read a series of papers, published research, original research from South Africa, the first in Africa, published in high-impact journals. Maybe you're probably not aware. We're speaking on the basis of research, not conjectures. Like I said, the biggest benefit of e-cigarette is if it was to help smokers. In the Tobacco Control Online First, published 3 weeks ago, 18,000 South Africans were surveyed. over 2,500 e-cigarette users. And we demonstrated clearly e-cigarette is not helpful to smokers in South Africa. So that's not a conjecture, that's not a projection, that is a well peer-reviewed science. So in other words, all of the situation in South Africa currently is that e-cigarette users are not, or smokers using e-cigarettes are not switching. They use e-cigarette, they quit smoking for about 3 months, maximum 6 months, they relapse. 65% will relapse to their cigarette smoking, and at the time we surveyed them, 95% continued to smoke. That is not harm reduction. And we cannot support a situation like that in South Africa. Now, what we need to understand is that those who are proponents of e-cigarettes should go to science. We have published these studies. We've looked at the exposure to vape shop that is encouraging 16 to 24-year-olds to pick up e-cigarette use. We have looked at cessation amongst over 5,000 smokers. So we need to look at research, and we're talking about research here. And that's all I do. I do science, and my science is what informed my position. So to just summarize, the biggest benefit for e-cigarettes for public health would come if it were to help smokers to quit smoking. And in South Africa, e-cigarette is not helping smokers to quit smoking. It's actually suppressing smoking cessation. They are more likely to relapse if they use e-cigarette than they use any other cessation aid or if they go to cold turkey. So that's what the research showed, and I think Dr. Leclerc should read that study, and we should engage on that science, nothing else.
Unfortunately, gentlemen... go ahead, Doctor. Yeah, go ahead.
I think we should just slow down and listen to each other. And we should be consistent. In health, we've been using nicotine replacement therapy to help smokers quit. There's a high relapse rate. I've never seen any researcher say because of the high relapse rate, nicotine replacement therapy is useless. Quitting smoking is extremely difficult. And the people need as much assistance as they would have. And we should always be careful when we do not give the full picture. Let us compare alternatives to nicotine replacement therapy with the successes of nicotine replacement therapy and pharmaceutical interventions. And then we could begin to talk. Let us be consistent. And that's why at the beginning I said the notion of quitting. This is a very difficult area. And I agree with the fact that industry should not be allowed to talk about quitting. They can talk about switching, not quitting. And I fully agree with the professor that the issues of marketing, the issues of advertising, the issues of reaching youth, those matters need to be looked into, and those matters need to be properly regulated and policed. I fully agree with that. But I think the fact that we've seen things that have been published in reputable journals, particularly on the subject matter, that have been withdrawn, that brings the credibility of scientists today into question. The fact that something has been published has become near meaningless because of lack of ethics, and where people propose certain viewpoints than speak to research as it is. And we then come up to conclusions that don't match up with what has been done. And I agree with him. This product should not be seen as cessation devices. This product, as he started correctly, people should be informed about less harmful constituents. You see, the same thing was done with something called snus, where the World Health Organization advocated that snus be banned. Today, 40 years later, the country where snus was originally not banned have less harmful health effects on their population than their counterparts in Europe. We're talking about Sweden. So we should be cautious about projections into the future and not allowing people to make informed choices. And I agree with him Claims should not be made about this as a therapeutic tool, this as a form of switching. It should be informed that the constituents in this product are less harmful than the constituents in combustible cigarettes.
Yeah, Dr. Letlape, I'm going to interject there. I can see that Professor Ayo Yusuf is wanting to come in there, but I think, Control, can we continue this discussion after the break? All right, we're going to continue having this discussion in just a moment. Don't go away. But an interesting discussion on the go around the need for regulation of e-cigarettes and the tobacco industry. To both of our guests, Professor Lekan Ayo Yusuf and Dr. Kgosi Letlape, we don't have a lot of time, so I'm going to ask you for your closing comments on this issue. In fact, Prof, let's begin with you.
Thank you. I think, again, I would, first of all, I'm a credible scientist. I've published over 100 papers in tobacco work for the last 20 years, and none of them have had to be retracted. So I need to let Dr. Letlape be very comfortable with that. And he, again, I'm sure he has not read these papers, and I'm not talking about one paper. And this paper has compared NRT, prescription medication. If you go to this particular one of the papers, it's figure 2, and it tells you the relapse rate you get with e-cigarette only. Those will use NRT. Indeed, if you use only NRT, you could get a 14% recent quitting with a relapse of 54. When you use e-cigarette alone, you get 21% quitting with relapse of 65. It gets worse if you use e-cigarette with any of the cessation aid. So what we're saying is we've compared this with other cessation aids, and e-cigarette was worse off. You're actually worse off in this population. And I'm saying again, this is the only one study. Now, you have to understand, when you read a study in the United States, for example, kinetics of release and nicotine in that is totally different from what is on South African market. Dr. Letlape should stick to science, read the papers before making conclusions. And you must not just draw from any other environment. And this is why we took our time for many months to actually look at the question around e-cigarette and its benefits. And I'm saying to South African public, it is not safe. It's got toxins. The flavors that are in the cigarettes, they might be safe when you put them in your mouth, but when you put them in your lungs, they are dangerous. So what we're saying, if it's not giving any benefit to those who are going to benefit the most at the public health level, why do you expose people to it? I'm not saying it should be banned. I'm just saying the current level of science we have today is that we should regulate e-cigarettes so that we can get the maximum public health benefit out of it. People are not currently switching, and they continue to smoke with it, and they're relapsing more than if they only did nicotine replacement therapy or any of the other well evidence-based therapies.
And how many people were surveyed in your study, Prof?
18,208. 18,200 respondents.
So Dr. Letlape, you've admitted that, there is definitely a need for e-cigarettes and the industry to be regulated, but your point, if I was understanding you correctly, is you're a harm reductionist. If it is safer than combustibles, it should be used.
Exactly. And I agree with many of the points that the Prof says. The fact